Burntwood Regional Health Authority is responsible for the operation and administration of community health programs and services across a vast geographical area of over 324,000 square kilometers. One of the most important facilities tasked with delivering effective health services to both the local residents and to a wide range of remote communities is the Thompson General Hospital. In September 2013, as part of a significant initiative to expand the Thompson General Hospital Northern Consultation Clinic facilities, a specialized pain clinic was opened. One of the doctors who spearheaded the opening of this clinic was Dr. Chandran Baker.
Well, I had been going out and doing some local work up in Thompson for a few years, and I was also doing pain management, so I approached Dr. Samazam, who was the CMO, and approached the region about opening a pain clinic, and they seemed very keen. And then we go into talks, and then they were very supportive of it, and then it came into being, and it's really become very busy, and it's obviously a great need for it.
Dr. Baker and Dr. Howard Intrader, both pain specialists from Winnipeg, visit the clinic 4 days per month and also consult with patients through telehealth. While the pain clinic can be tasked with supporting the needs of patients who are suffering some kind of acute pain, such as post-surgery discomfort, much of their work is related to long-term chronic issues.
The majority of our practice is related to spine pain, so anywhere from the neck down, and that would be the majority of our patients.
Because chronic pain is something that usually has been with that person for a very long period of time, we do want to find out as much as we can about that person's pain. So we want to find out what was the onset, how did it start, what's the pattern been sometimes over years, is it something that's getting better and better or something that's getting worse and worse. We want to find out what types of treatments have been helpful so that hopefully we can maybe embellish upon those. We don't want to retry things that have not been successful in the past.
A significant difference between acute pain and chronic pain is the psychological aspect.
If you're having chronic pain and you're not sleeping at all, then your ability to cope, the intensity of the pain, you get more irritated, and that impacts the people around you. The issue of chronic pain is that you could be sitting there and you could be having chronic pain and I couldn't tell. So people tend to have a hard time believing that people are having chronic pain, and that includes often people close to them, workers, family, etc.
We do use what's called, sort of has a big name to it, a biopsychosocial model in managing patients with pain. And basically what that means is, certainly one of our main goals is to try to reduce the pain level for our patients, but we also want to help to improve their functional level, and we also want to help them better manage all of the different aspects of how their chronic pain is interfering with their lives.
Specialized equipment such as the C-arm X-ray machine, fluoroscopy unit, and ultrasound enables doctors to get the best possible view in areas where the pain is originating, guiding them precisely to problem areas. Local anesthetic can be delivered to exactly the right spot, where it can do the most good.
This is a fluoroscopy machine that is used to do special injections on patients that have different chronic pain issues such as back pain or hip pain. It gives different angles of views for the doctor to see so that they can put freezing or local anesthetic and steroid injections into certain areas that are causing people pain. It's actually an X-ray machine, and it comes and goes at different angles if they need to see special views.
It is much nicer to be able to actually see the spot that we want to target. We can see our needle going to that target. Because in the past we used to do it just with what we call landmark techniques. We knew sort of where that area was, but you can't see sort of under the skin. And it's much nicer and much more accurate in using equipment such as the fluoroscopy unit and the ultrasound unit to help us target those pain generators.
In all, the Northern Pain Clinic has treated over 2,000 patients since its opening in 2013, and that number continues to grow. The clinic brings the latest pain treatment technologies and dedicated specialists closer to patients across Manitoba's northern region.